Welcome back to the Daily Drum on WHUR and Sirius XM, channel 141. I'm Harold Fisher. Tonight, for our Medical Monday conversation, we're talking about proton therapy for cancer treatment. Now, it may sound to you like science fiction, but it is a high-tech fact and an option for treatments of some forms of cancer. My guest tonight is Dr. Melissa Weifhaus. She is the medical director of radiation oncology for the University of Maryland Capital Region Medical Center. Dr. Weifhaus, thank you so much for joining the conversation.
Thank you for having me.
Sure thing. So let me start with the obvious question, because most people, when they think about seeking treatment for cancer, there's just a lot that they don't know.
Right.
And obviously, when it comes to trying to treat yourself for cancer, there's a lot about the disease that a lot of people don't know. And proton therapy is not something that you often hear about when talking about those who have cancer and the kinds of treatments that are available. So explain to me what it is.
So proton therapy is a form of radiation treatment. It is a charged particle that what it is, it has an entrance dose, it enters the body to target the cancer, but because of the physical properties of a particle, of that proton, it doesn't have an exit dose. So that is very valuable in terms of cancer treatment and trying to spare normal organs at risk. So we can hit our target with the proton therapy, with that radiation, and we can really spare the normal organs surrounding the tumor much better with proton therapy than what we call photon therapy or regular radiation treatment using X-rays. So that's the big difference between the two.
Okay, so one is, to use a term, laser focused, and the other one is more broad?
That's a good way to think about it. Yes, both are pretty precise in hitting their target, but the properties of a proton can really spare the normal surrounding tissues. With regular X-ray radiation treatment, you do have that target focus, but you have a low dose spray of radiation that kind of gets to the surrounding organs when you compare the two treatment modalities. So that's the big difference.
So is proton therapy applicable to all forms of cancer?
That is a great question. There are some cancers where proton therapy has a bit more bigger bang for the buck, and that's compared to photon X-ray radiation treatment. So, for example, in patients that had radiation before in the past, right, and their cancers come back and they need radiation again, heaven forbid, proton therapy is helpful because it can help spare those tissues that already seen radiation. Or if patients have a cancer, for example, in the head and neck region, and we're really worried about radiation dose to the spinal cord or to their saliva glands, proton therapy offers an advantage. In women, for example, if they have locally advanced breast cancer, so on the left side, what's on the left side that we're really worried about? A woman's heart, right? There are some techniques that we can use with regular radiation, with photon therapy, to help decrease the dose of radiation to the heart, but every woman is unique and different. And sometimes proton therapy offers an advantage in those circumstances.
If it offers an advantage, because I was about to ask specifically about breast cancer, for example, is this an advancement, or is this just an option when it comes to therapy? Are there circumstances under which proton therapy may not be as advantageous as perhaps a traditional radiation therapy?
That is a great question. And that is something that is a case-by-case basis. So for example, in women with breast cancer, if a woman has early stage 1 or stage 2 breast cancer, where we don't have to treat a large area, just the breast, there is no real advantage, to be honest with you, with proton therapy in that circumstance. where our target is the breast, and we have different techniques that we can use with regular radiation or photon radiation that are pretty comparable between the two modalities. So in that instance, I would not recommend proton therapy. Now, if a woman has more advanced disease and I'm treating not just the breast, not just the chest wall, but the other areas where the cancer likes to travel, like the lymph node areas, in that circumstance, in some women, proton therapy can be more advantageous. And for example, what I like to do is I do a comparison plan. So before I send a patient to Baltimore for their proton therapy treatment, I say, let's look at the advantages, if there is any, with proton therapy. And that's a decision that, I sit down with the patient with, and I say, hey, these are your options. This is the advantage with proton therapy. I think it's worthwhile going to a proton center for treatment.
Outside of that, for a layman, how would you know that you are a candidate? For example, we just spoke about breast cancer.
Yeah.
Would this also be applicable, say, for men who are dealing with prostate cancer?
Yes, it would be. We do have some clinical trials open now comparing just that, proton therapy versus photon therapy in women with breast cancer and men with prostate cancer. But it really truly is a case-by-case basis. We have been treating cancer for many, many decades with photon therapy. So not every case is a slam dunk for proton treatment. And I tell this to my patients, but it is a case-by-case basis. And if there's a clinical trial that we have open that can help answer that question, which patients would derive a greater benefit with proton therapy, I give my patients the option. I definitely give them that option to join.
You mentioned a clinical trial, not to go off on a tangent, but that always really piques my interest, particularly for our listeners, when we've had physicians on this program for many, many years who have tried to make sure that people of color are part of clinical trials. What specifically can you tell me about this clinical trial? And even more importantly, is it still open for those to participate?
Yeah, so that is a great point that you bring up, that people of color, our community and clinical trials historically don't go hand in hand. And there's a lot of mistrust in our community. And a lot of my research nowadays is trying to overcome that mistrust to get our community to join these clinical trials. And we have quite a number open at the Proton Center. At any given moment, they're fluctuating and changing at a given time, but we do have several prostate clinical trials open. I believe for about 3 or 4 of them open right now, and they are still available for our patients as a option and as a resource. Yeah.
I hate to put you on the spot, but how might somebody find out about these clinical trials? And again, I reiterate, even as the conversation about clinical trials more broadly goes on in our community, there may be at least 1 or 20 or 50 people listening to this right now who may say, hey, count me in. Do you have any information about where they can find that information?
That is a great question. So if you go to the website, marylandproton.com.
marylandproton.com.
Yep. They have it right on the upper portion. It says research and clinical trials. If you click on that, you can see what clinical trials we have available and open at any given time at the Proton Center.
Wonderful. Maryland Proton, that's Maryland.
MD Proton, PROTON.com.
mdproton.com. I really appreciate it. Like I said, I didn't want to go off on a tangent, but again, the clinical trial issue is really, really important for this community, and it's certainly particularly as it relates to cancer patients who may otherwise not have options.
Yep. No, I agree with you 100%. And that's something that's near and dear to my heart, and something I'm very passionate about, trying to improve not only clinical trial enrollment of racially minority patients, and especially within the Black community, but making sure that they have access to and understand it and know that it's available within their community.
This is a Medical Monday conversation. We're talking about proton therapy treatments for cancer patients. We're going to take a break, but don't forget, you can hear this in every edition of the Daily Drum Insight segment via podcast on WHUR.com. The Daily Drum will continue on Sirius XM Channel 141. The Original Quiet Storm with John Mons is next on WHUR. I'm Harold Fisher. This Medical Monday conversation will continue on Sirius XM Channel 141 in just a few seconds. Welcome back to the Daily Drum on Sirius XM Channel 141. I'm Harold Fisher. We are continuing our Medical Monday conversation about proton therapy cancer treatment with Dr. Melissa Weifhaus. She is the medical director of radiation oncology with the University of Maryland Capital Region Medical Center. Dr. Weifhaus, I want to continue with some of the other important questions.
Mm-hmm.
A lot of people often, when you hear about radiation
Mm-hmm.
and the impacts of cancer treatment, we heard about chemotherapy, obviously, and all of those other things. What are the potential side effects and risks associated with proton therapy? Are they the same as traditional radiation therapy?
No, that is an excellent question. When I think about side effects or toxicities from radiation treatment, I like to think of it in two buckets, two categories. One, side effects that patients can experience during treatment. And typically these side effects are about the same, or maybe a little bit less with proton therapy when compared to X-ray treatment or photon therapy. And then side effects that can happen months to years after radiation treatment. So during treatment, most patients tend to experience very similar toxicities: fatigue, feeling tired. A lot of the toxicities that patients experience during radiation depends on where we're treating in the body. For example, in women with breast cancer, they can get redness, soreness in the breast, a little bit aches and tenderness. And those side effects aren't that much different compared to regular radiation and proton therapy. However, down the road, because proton therapy treats or have less exposure to normal organs, right? The radiation doesn't reach normal organs as extensively as it does with regular radiation. Patients' risk for secondary cancers or cancers that develop from radiation are significantly less with proton therapy. That is why any children, for example, who unfortunately need radiation, they automatically go to proton therapy, right? Because they have many more decades of life ahead of them, and their risk of having secondary cancers is pretty significant. With proton therapy, we're sparing the normal tissues a lot better, so that risk is a lot less, okay?
No, please continue.
I didn't want to, okay. And so, for example, with prostate cancer, the long-term toxicities with proton therapy is less in terms of urinary toxicities, the urgency, the frequency that some men can still have and retain after radiation treatment is less with proton compared with regular photon radiation treatment. So there's just, and with lung cancer, for example, again, proton therapy can spare the normal lung a lot better in certain circumstances compared to regular radiation. So a patient's risk for what we call radiation pneumonia can be significantly less with proton therapy compared to photons. So it just really depends on where we're treating, where that toxicity comes into play. And the benefit with proton therapy seems to be more long-term, right, than during radiation treatment, where that toxicities can be very similar between the two modalities.
You mentioned children.
Yes.
And more broadly, young people.
Yeah.
What impact does proton therapy have? Is it more advantageous for very young cancer patients as opposed to mature cancer patients? And if so, why?
That's a great question. So yes, it tends to be more advantageous for those who are very young. We know that radiation can cure cancer, can kill cancer, but radiation can also cause cancers down the road, what we call secondary cancers or secondary malignancies after treatment. And we know that this secondary malignancy risk is increased when you have more radiation exposure to normal tissue, to normal organs at risk, right? So in children or young adolescents, when they're exposed to radiation, they have that time after treatment to develop that second cancer, if that makes sense. They have many, Lord willing, they have many more decades of life ahead of them. So that radiation exposure when they were 7 or 9 can change into another cancer when they're 50. Okay, so we want to minimize that as much as possible. Proton therapy can do that. Now, when we're older, okay, when we're already in our 50s and we're battling a cancer, we don't have that time ahead of us like we did when we were 9 or 10. So that risk for developing a secondary cancer in someone who is older is significantly less than someone who's a teenager or a child. And that's why proton therapy is so critical for young adolescents or for children who need radiation treatment.
So if, just for the sake of this conversation, all cancers are different, and you certainly would know that better than I. But for those who have had any kind of medical procedure, we know that you get an email, you get instructions, you can't eat, you're not supposed to sleep, you need to stand on your head for 15 minutes before you come to the hospital. You know, you've got to wear one pink sock and one blue sock and the whole bit before you go through the process. Right. And certainly I say that tongue in cheek, but we know that there are details that must be addressed before you go through this procedure. And proton therapy, as I also mentioned at the very beginning of this, it seems like a term of science fiction, and I've seen the device, and obviously since you can't see it here, first and foremost, walk us through what happens when Dr. Whitehouse says, okay, Mr. Smith or Ms. Jones, you're going to need proton therapy, or this is what I recommend. Just walk us through the process. What happens? What is the preparation prior to even showing up for the therapy?
That's a great question. So when I sit down with my patients and we say, hey, you need radiation treatment for your cancer, and we think proton therapy is the way to go. To prepare for radiation treatment isn't really that different between proton therapy and photon therapy. It requires the patient to come back to the department, come back to the proton center, and when we do a CT scan and we do a CT simulation scan, and we use that scan while the patient's in the treatment planning position. And that position varies depending on the cancer. For example, I'll use the two most common ones. For breast cancer, that means the woman would lay on her back, her hands would be over her head, we'll make a mold of her body to make sure that she's in the same position every day for her treatments. And for example, if we're treating the left side, her arms will be out of the way, her head will be out of the way, so we have access to that breast. Same thing with men with prostate cancer. They'll lay on the table, we'll make sure they're nice and comfortable, we'll make a mold of their body to make sure they're in the same position every day for those treatments. And for prostate cancer, we tell men to have a full bladder when they come in for not just for the CT planning, but for radiation treatments, because the bladder is nice and hardy. When it's ballooned and big and full, it pushes the small bowel out of the way, and we could just focus on the prostate. So that's those specific circumstances. We do that CT plan. We do some calculations on the computer. The physician will draw out the area that they want to treat. Our dosimetrist, our physicist comes in, and they help to make sure the plan undergoes quality assurance and that everything is safe and accurate. So it's a huge team that comes together just to treat one patient. And we do that for both proton therapy and photon therapy. And then the patient comes in for the first day of treatment. And then they use that same device that kind of molded to their body every single day for their treatments. And that's sort of like the general process that we do. If a patient has a brain tumor or head and neck tumor, they don't have a mold of their body, they use a mask. So we'll make a mask for them to make sure that they're not moving during their treatments. And that immobilizes them again. So it's safe and that we're only treating the cancer and not anywhere else.
Describe the proton therapy apparatus for those who are not really familiar with it. It appears, for those who are interested in certainly Googling it or what have you, this is not quite as claustrophobic inducing as perhaps you may get from a CAT scan or I'm sorry, CT scan or the like.
You're absolutely correct. So with both modalities, photon and proton therapy, I tell my patients, and I'm also claustrophobic. If I can do it, you can do it. It is a wide and open room. You can breathe easily. You're not enclosed in a space, and the radiation comes from a gantry head, and it kind of rotates around the patient and delivers the radiation treatment as we planned it. So it's a nice open area. Now, some patients do get claustrophobic when they have to wear a mask, okay? But we can always give patients different medications to kind of calm them down and get them through treatment. I've never met a patient, knock on wood, that we couldn't work with to get through therapy.
Is this as noisy as the CT scan? Because it's so interesting that you talk about some people getting claustrophobic. And I think this is really important that we are able to paint a full picture of it, because some people absolutely refuse because the CT scan can be so confining, and you hear that when I'm not claustrophobic. All I request, if I don't have to move when I've had CT scans, is give me some earplugs and I go to sleep.
Yeah, it is not noisy at all, and it's those MRI machines that are kind of like loud and enclosed space. It is not loud at all. But actually, what we do, we ask patients, and we do this at the Proton Center and at our institution here. What kind of music do you like? So we have headphones, we have like speakers in the room, and that helps to keep patients sort of entertained and relaxed during treatment, depending on what kind of music they ask for.
Right, exactly. Or maybe they can bring their own Cardi B.
Right. But I've had patients ask for her too. Yes.
Whatever you need to get you through the process and to make you feel comfortable.
You got it.
Now, what determines, first of all, how long the process is in one visit, and whether or not you have to return for more treatment?
That's a great question. So in general, ideally, it's a one-time done treatment. If I am treating you for a prostate cancer or a breast cancer treatment, that however many weeks, 3, 5 weeks or so, or sometimes with prostate cancer, it could be up to 6 weeks or even 8 weeks. That one time, that treatment regimen is typically one and done. The number of treatments that you need really depends on the type of cancer. So, for example, for breast cancer, we can treat as little as 5 treatments or as much as 5 weeks, depending on the stage and what our target is. For prostate cancer, it could be as little as 5 treatments or as much as 8 weeks of treatment. It really depends on the patient, the stage, how aggressive the tumor is, and things of that nature. That really decides or really dictates how long each treatment regimen is. But once we finish that regimen, ideally, that's it for the radiation in that area, if that makes sense.
So now here's a more technical question, but again, I think these are kind of the questions that patients would be curious about. If your doctor gives you a prescription for pills,
okay,
and the doctor says you need to take 3 pills a day, okay, but then you have a friend who has the same ailment, and they're only taking perhaps 1 pill a day or a half pill a day. So in this particular analogy, how do you determine the dosage of the radiation? Is that dependent on the kind of cancer, the stage of cancer, and what is the difference between a higher dose and a lower dose?
That is a great question. And I always, because patients do ask that. They come to me and say, Doc, I had my friend who was treated for breast cancer and she only got 5 treatments. Why are you telling me I have to come in for 5 weeks? Well, and I tell patients everyone's cancer is unique and different. Even if it's a breast cancer, even if you both have prostate cancer or lung cancer, you can't compare the two. It's like comparing apples and oranges. So for example, let's take breast cancer, for instance. If a patient has a stage 1 breast cancer, we have regimens that have been clinically proven, scientifically proven through clinical trials to be safe and effective as low as 5 treatments. We can give it to a patient, they can be done if they have stage 1, stage 2, really early stage breast cancer. However, in women who have more advanced disease, where we have to treat a much larger area, not just the breast, but the lymph nodes surrounding the breast where the cancer likes to travel, we have to be a little bit more gentle with our treatment, or with our what we call fractionation of radiation. And so 5 weeks to do that. However, there have been recent studies showing that we can probably do that safely in 3 weeks. So science, medicine is always evolving, always changing. We're always trying to figure out ways, how can we make treatment shorter and more efficient for our patients so they don't have to keep coming in for 5, 6 weeks? Can we do it safely in 3 weeks, in 5 treatments? So the radiation, the field is evolving to shorter and shorter treatments, but we have to make sure it's safe. And that really depends on what stage the patient's in, and then what type of cancer it is. So I use breast cancer as a good example because it ranges in terms of how long the treatments have to be.
And the first thing I'm thinking about now also, how do you know, what do you have any information about the success rate of proton therapy versus the traditional radiation, and how does that figure into someone making a decision as to whether or not they're going to go forth? I mean,
that's an excellent question. Yeah, so I think what you're asking is, do we know if proton therapy is just as effective as photon or traditional radiation? And the short answer is yes. We do have data to support that in the literature. And how I explain it to my patients is, radiation is going to get the job done, whether it's proton therapy or photon therapy. It's going to hopefully, knock on wood, cure your cancer, right? Both of them equally. A lot of the studies that we have going now comparing the two, they're not focusing on whether or not the cancer is going to get cured, because we know that it's going to get cured, but we're focusing on, are the patients going to experience a benefit from it in terms of toxicity? For example, we do have a clinical trial that just closed in women with breast cancer comparing protons versus photons. They have advanced disease. And the outcome of that study, again, isn't cure, because we know both of them get the job done. We have data describing that. But which one can prevent heart attacks down the road? Which one can prevent strokes down the road?
Yeah.
Which one can prevent these sort of cardiovascular events that we see in women that have to get radiation treatment on the left side? So it's very fascinating that you asked that, but we do have data to support proton therapy in terms of cure. But more importantly, because we know both of them get the job done, which one is safer for patients down the road? Which one's more, it shows a better benefit or a greater benefit in terms of toxicity months to years after radiation's done.
Right. And see, there you go. That you went straight to my next question. We want to be cured.
Yep.
Patients want to be cured, obviously. But long term, and I have to keep emphasizing, every cancer is different.
Yes.
Breast cancer is not lung cancer. Lung cancer is not prostate cancer. But what long-term considerations do you share with patients in the cancers that are best treated by proton therapy?
So I think that is a great question. So I think the example I gave with women and heart toxicity is the one that comes to mind, because
Mhm.
everyone is unique and different. Everyone's cancer is unique and different, but we have gotten pretty good at curing breast cancers for the most part, right?
Mm.
We were catching cancers early. We have fantastic systemic treatment nowadays to treat multiple different types of breast cancers. And so when I talk to a woman about her breast cancer, I said, hey, I'm very, we can get you through this treatment, but what can we do to help you live as a successful cancer survivor? Right. And then I talk to them about the importance of eating right, staying healthy, exercise,
Yeah.
because radiation can damage the heart. It can increase your risk of toxicity down the road, cardiovascular events, heart attacks, and strokes, but so can different chemotherapy agents. So can targeted systemic agents can do that as well. So when I look at a patient, I say, you're going to live a long time, Lord willing. What can I do to help you live as a healthy survivor after we're done with your treatment? And that's where proton therapy can really come into play. Especially for women with left-sided breast cancer, especially for children who have to undergo cancer treatments, especially for our young men who are diagnosed with prostate cancer. And we want to make sure their quality of life is sustained after cancer treatment, right? Because your life doesn't revolve around your cancer. You're going to be done with treatment, and you want to live with the highest quality of life as possible after therapy. And so that's what I think about moving forward in terms of dictating when I really push for proton therapy, or when I say, you know what, it's okay, you can get treatment at your local community radiation oncologist.
So let's talk about the thing that a lot of people are certainly concerned about, the cost of this.
Mm,
Assuming, for example, that someone in the best of circumstances may be a gainfully employed person who
mm,
has a very, very good insurance,
mhm.
but we could have a whole conversation about insurance
Yeah, we
companies,
can.
which I'm not going to have right now. But how much does treatment cost? Whether it's 5 treatments, 5 weeks.
Yeah, that's a great question, and we know that uh, that proton therapy has to be a resource for everyone. For those with not so great insurance, like you said, lower socioeconomic status, within the Black community, especially, right? I've done a lot of research to kind of show that Black women, for example, may derive a greater benefit from proton therapy in their locally advanced breast cancer compared to regular radiation or traditional radiation. But the Proton Center does something very unique, actually, at the Proton Center in Baltimore. It accepts a variety of insurance types, including Maryland Medicaid. And to ensure that patients have access to this treatment modality, the Maryland Proton Treatment Center does use a cost neutral model for pricing. So, what this means is that the cost for protons is similar or equal to the cost of traditional photon radiation treatment. And because of that, the insurance approval rate for our center, for the Maryland Proton Treatment Center, is above 90%. So we have a cost neutral model. So the cost of proton therapy isn't sky high compared to traditional radiation treatment. And because we have that approach, a lot of different patient populations have access to this treatment modality that they otherwise wouldn't be able to.
Do you have again a number? So this is, and this may probably not be the best example, but for example, when you talk about MRIs, for example, I have very good insurance,
Mhm.
and the like, but I've seen the bills for just one MRI, and we're talking $500.
Mhm.
Okay, that's just without the deductions, copay, just it's going to cost $500 for an MRI. Okay.
Right. Mhm.
So before the assistance, before the 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 kinds of opportunities that those who may not have the best insurance or what have. I mean,
Right.
how much does one treatment cost? Are we talking $500, $1,000, $1,500,
Uh,
2,000? Do you
so
have an
so in general, I have a general number, but in general,
sure?
cost really depends on the cancer type. How many
Aha.
how many treatments we're planning or we need to safely deliver, and what type of image guidance. I'm not going to go into too much detail, but image guidance that we use during radiation treatment to make sure that we're hitting our target and nowhere else. It can range between $40,000 to $60,000. It's expensive, relatively thinking, but remember the steps that we talked about. It's not just the doctor signing a prescription saying, "Okay, get your radiation." We have therapists that set up patients every day. We have physicists that ensures that we're giving the best quality radiation and everything it has quality assurance. We have nursing. We have dosimetrists that plan the treatment. So it's an entire team that has to come together to do just one radiation plan for one patient. So that's where the cost comes into play. However, if you go to other proton centers in the nation, their cost is significantly more than that, maybe even 2 to 3 times higher than that. Our cost is the same. And that's why insurance companies like dealing with us at the Proton Center, because we're not here to make an egregious amount of money. We're here to offer our community a resource that for the most part is not accessible otherwise.
Yeah. And I think that's important when you have these discussions, because some people do have very good insurance.
Yep.
Certainly there are so many factors,
Mhm.
whether it's, and no one wants to be sick,
Yeah.
obviously, but they also want the process to be as easy as possible, and one that prayerfully has the outcome
Mhm.
that so many people want. I've got a couple of more minutes if you
Sure.
want to share some final thoughts about proton therapy and and indeed the future of cancer treatment.
Well, I think the beauty of our field of radiation oncology is that we are always advancing. We are always trying to improve cancer care, whether that's through technology, such as
Mhm.
proton therapy, making sure that we have clinical trials available and open to our community, or whether it's trying to address the cancer inequities present in our patient population. What are some practical solutions that we can do to help mitigate cancer inequities in our patient population? So I think we're always trying to advance cancer care for our community, for our patients. And we do this not just at our Proton Center, we do this at our community sites as well. So for example, I'm in Capital Region Hospital Cancer Center. This cancer center just opened in April. And so we are bringing that sort of uh, clinical trials available from University of Maryland and advanced technology available to our community in Prince George's County. And so that's something that we as a institution strive for. And then we are doing in our community, not just at the Proton Center, but at our other locations as well.
Mm. Uh, Dr. Vifehouse,
Yes,
thank
sir.
you so much for sharing your thoughts about this. This is a really important information. I hope that we've been able to give some people some really great detailed insight into cancer treatment, and certainly we want success for those who do have proton therapy. Although certainly ultimately we hope that no one gets cancer, which is even the most
Mhm.
important thing. But again, thank you so very much. I appreciate your time.
Thank you.
That is the Daily Drum for this Monday, July 1st. I'm Harold Fisher. Good night.